All right, thank you, DJ in the back. If everyone can take their seats, and can I get, I don't know, 2 or 3 volunteers to just shout out what you, tell me about Chicago. I'm a New Yorker, so I'm learning about Chicago. Just give me, say, you're from Florida. Awesome, Florida's a great place too. Someone said deep dish pizza. Yes, Chicago is known for deep dish pizza. What else? Give me, who else would like to shout something out? Architecture. Yes, Chicago is known for its architecture. Deep dish pizza. Wind, the Windy City. Okay, so now what we've learned about, what was that? Paul Racy, that's right. So, of course, Michelle is like yelling all the answers. So anyway, the point of this exercise, one, was we knew there was a 2-hour thing, so we wanted you to get up and sort of enjoy yourself. But it was also to sort of prove, so this session is going to be a very high-level discussion on what is NF? And I know a lot of you know that better than any of us could describe it, but very often you're meeting someone for the first time and you need that sort of very brief, how can I talk about the disease that I'm working or living with in a very short way? And what we've learned over the years, most of us have been with the foundation almost a decade at this point, and we've realized that very often people sort of give a definition. It's not always consistent. It's okay, because you should say what you know and what you believe. But then very often it goes into your personal manifestations, which is good too. And there's a session tomorrow on storytelling, which we're gonna talk about in a second. But it can cause a little bit of confusion for people who don't know NF, because then it becomes a lot of different definitions. So the exercise, a little bit of Chicago too, is what we've learned is that Chicago is the Windy City with pizza and architecture, but everyone had different, and that's cool, those are all correct, but they all had different definitions. I still, in a way, don't really know what Chicago is. So what we're calling is many voices, here, many voices, one message. So our message is to end NF. It's to promote CTF for those of us connected with CTF, for the other organizations in the room as well, but in one voice, in one theme. So the benefits of this, why? Why is this so important? So in a world where people are constantly being bombarded with so many different messages, there was an old adage, I think, in the ad industry that you needed to hit people 7 times with a message before they started to recollect it. It's probably even more than that now, between your emails and your social media and what's on TV and everything else that people you're talking to. So people just need to hear it over and over and over and over and over. So don't be upset if your friends get upset that you're talking too much about NF. It's okay, they need to hear it. Consistency in messaging is important. Why? When people hear the same message over and over, it becomes dependable for them. They start recognizing what that message is. Once they start recognizing what that message is, they start trusting the message. Now in politics, this could be a little dangerous, but we're not political here. This is about NF, but it is important that people understand that things are trustworthy, including the Children's Tumor Foundation and other groups, again, affiliated in the room. And very often, and I find this even with folks who should be able to explain NF better than I can, come to me and say, I'm doing a media interview, what do I say? And my response is, well, be yourself. You know NF better than I do. But we all get nervous, we're all human. So we want to help you sort of remove that anxiety. If you know what the sentence is that you should say, or the 5 sentences, or whatever the amount of time it is, you'll feel better and you'll be ready to go. So today we're using the examples today for the Children's Tumor Foundation, because we're the host. But I do want to give a shout out, like Annette did earlier today too, to the NF Collective and all the other groups who are in the room and affiliated with this summit. Not on this list is Be the Difference. Want to give them a shout out too, because they were involved as well. So as we're going through this, just replace CTF with your org. Totally fine. We're going to make this deck available to everyone afterwards. Feel free to tweak however you need to tweak. This is for everyone. Our motto, or our belief, and I think the whole team believes this too, is when we put out, we're blessed, we're thankful that we have a donor base that allows us to have a full communications team. So when we create stuff, we want you to take it, we want you to use it, we want other orgs to use it as well. We like to share and partner as much as possible. So as we were approaching this, one of the things we often hear is, what's the elevator pitch? And we started approaching this presentation that way. I'm going to pick on Vanessa. You're raising your hand. I've been asked to slow down. I apologize. Thank you. So Vanessa usually puts me in line. And one of the things the other day, we were talking about this, and sorry for going too quickly. We talked about elevator pitch, and Vanessa said, seriously, how many times are you really on an elevator where you're talking about NF? And it's funny because we just got to a building that's 43 stories tall. So we could actually test this a little bit later and see how it goes. And also, I inadvertently rode the elevator this morning with Paul Racy, so I should have tested. I don't know if he's still around, but we might be able to test him later. But what we decided was that this was more like 3 cups of coffee. Sometimes you just want that quick espresso, the small cup, just a quick little shot of, here's what it is. Just get someone to pay attention. Then you've got the medium cup, which tells a little more, and then large is obviously, you really need the full dose. And in each of these examples, which the team is going to take you through, that small dose is just, what is the problem exactly? What is it exactly that you want me to know about NF in the briefest, shortest, easiest, wake me up kind of form possible? Then you've got, why is this important? Because just because it's important to us, it may not always be so important to others. So you need to convince people, and you've got a little more time to do that. And then you've got the large cup, which is what can be done about it. And that's where CTF and all the NF community come together to make that happen. So we are going to start with small, and I'm going to turn it over to Rebecca. Either way, you can stand or sit. Okay.
I like to stand. All right. I've never done it like this. So you can see NF is a group of genetic disorders that causes tumors to grow on nerves throughout the body. This is simple. It gets to the point really, really quickly. It's important that we're all saying the same things, like Simon said. That's how we build awareness. In this definition, we are starting with the commonality of the disease. This is what binds us all together. So a few things I do want to point out. You'll notice we are not saying NF1, NF2, or schwannomatosis yet. In the larger cups, that will come later. We're also not starting with personal stories and experiences. That also comes later. This is really sort of an umbrella statement. We're not capturing everything. We're just capturing like a really good foundation, very easy to remember, and then we're going to build on that. One thing I do want to point out, the question of disease versus disorder. We have done the research, we have talked to doctors, we have checked dictionaries. They are the same thing. So from CTF's perspective, we will use either word interchangeably. For everybody else, use the word that you are comfortable with. So if you like to talk about the disease, great. If you want to talk about it as a disorder, that's fine. CTF is going to use both. And so, yeah.
Okay, so Rebecca talked about the small size. Now we're gonna give a little bit more information in the medium size. And the goal here is to really get across to your audience why it's important and why they should care. So to do that, we're gonna explain who NF affects, how it affects them, and why we need to take action. So starting where Rebecca left off with the definition of NF, we'd say it affects 1 in 3,000 births, which is about 2.5 million people worldwide. Anyone can be born with it, and it affects everyone differently. NF can lead to blindness, deafness, bone abnormalities, disfigurement, learning challenges, disabling pain, or cancer. There is no cure yet. So we're going to break this down. First, who is impacted? The 1 in 3,000 or 2.5 million people gives your audience a concrete number to wrap their heads around, and then stressing the point that it really could happen to anyone. And so it makes it really relevant to your audience, even if they don't know someone with NF, now they are understood that anybody can be born with it. You'll also notice that maybe compared to the past, we're not comparing ourselves in this description to other diseases. Those comparisons that we've used in the past really distract from the message, and it doesn't help get that concrete number across to your audience in a very quick and easy way to understand in terms of prevalence. And then in the short amount of time that you have, we really want to focus on those specific manifestations that your audience can understand and connect with. And you'll see that what we've laid out here is, even if your audience doesn't understand or know NF, they do understand blindness, deafness, cancer, pain, and can connect with those very concrete examples. This is also a reminder that this is not the time, or this is the time to discuss NF in broad terms and not the specific manifestations that you or your loved one may have. There will be a time again later down the line to talk about your personal experience, but this is the moment to talk to your audience about the complexity of NF, that it can present so differently. The last session really nailed that home. So this is a time to talk about how it affects everybody differently, from individual to individual, family member to family member. And that's also why there have been, like, that complexity, or why there have been so many challenges with visibility and awareness of NF, because it manifests so differently, and then the challenges with diagnosis and treatment because it's so complex. And then that leads us to the last point, why they should take action, because there is no cure yet. And as Paul Racy spoke about this morning, that yet is a very important word to create that positivity of where our future is leading. Again, there's going to be space, and Vanessa will go through this, to talk about the progress that's being made. But in this part of the conversation, you really want to care, people to care, because it's a problem that hasn't been solved yet. And we need help solving it. And if we start by getting into the advancements or the specific treatments right here in the part of the conversation, your audience might not feel that urgency or the need to get involved. Where are we at?
So as Simon mentioned, if we're on a really tall elevator with like this building, and we have 44 floors? 43 floors, you have time for a large cup of coffee. So just like Rebecca and Alissa talked about, we talked about why it's a big deal, and what we can do about it. Before we move into the large cup of coffee, I do think it's important that we address what we just heard in the last session, which is that there have been some changes in the way we talk about NF, as was referenced in the previous talk, and you're going to hear more about this from Dr. Yohei this afternoon. About 5 weeks ago, we had a publication that changed the names, the terms, the nomenclature for NF2 and schwannomatosis. So what you'll hear is, for the Children's Tumor Foundation, we're going to start working in those new terms. So you'll start to hear us talk about NF2-related schwannomatosis, LZTR1-related schwannomatosis, SMARCB1 schwannomatosis, but we're still going to use the term NF. We're all still here at the NF Summit, and we just finished the NF conference, and we're going to make NF visible, and we're referring to all types of neurofibromatosis and schwannomatosis. We're going to use that as an umbrella term for now. Change takes time, we have the Children's Tumor Foundation has always been working for all types of NF, and we're still going to work for all types of NF. And just like way back, I think it was I'm sure Annette knows, in 2004, we became the Children's Tumor Foundation when we were the National Neurofibromatosis Foundation, and that change took time. Before we were neurofibromatosis patients, we were von Recklinghausen syndrome, and that took a long time. So you'll continue to hear us talk about NF, and whenever we use NF2-related schwannomatosis, you'll still hear us talk about formerly known as NF, but when you hear those terms, you'll know that that's the way we're using them. But we want us as a community, it's important for that commonality that Rebecca was talking about. If we kind of get into that when we only have that time in the elevator, that's all we have time to talk about. By the time we get through the name change and the difference in the different types, we're already at the bottom floor, and we've missed our opportunity to talk to people about why this is important and what progress is being made. So we're just going to kind of keep it quick and talk about NF. So that being said, as we're in our elevator and we are riding down those 44 floors, when we can add this last part, where Alissa left off was that there's no cure yet. But getting back to Paul Racy's positive thinking, there is progress being made because of the Children's Tumor Foundation. CTF is the world's leading nonprofit fully dedicated to making NF visible, connecting patients with support, and driving innovative research to end NF. So this completes our elevator pitch, and we absolutely We'll be repeating this pitch in all of our patient materials and our annual report. It's a great thing to practice, to talk about, so that when you get on the elevator with Steven Spielberg and you want to pitch your idea for your screenplay about NF, you have this ready to go. You don't have to think about it. You don't have to fumble around. You've got it ready to go. And hopefully when you get to the bottom floor, he'll say, wow, I'm interested. Now let's go sit down and have dinner. And then you can talk about your story. You can talk more about what the Children's Tumor Foundation and some of the things that Simon's going to say, which we're going to let next, if you want to just advance the next slide, to talk about what is the Children's Tumor Foundation, what is CTF, what is NF. And this is where you can sit down and really elaborate on all of the great progress, some of the things that Annette talked about in her talk this morning in her introduction, the clinical trials that we're working on. Simon's going to get into a little bit more. If you want to go into, just talking about that, we're a reputable global foundation. We do work for all types of NF. We're not just the Children's Tumor Foundation. Very often we get a lot of questions about, well, is it just kids? In fact, I was just at breakfast this morning was talking to someone and they asked me literally right here at the NF Summit, well, is it just kids? No, people are more often diagnosed as children, but NF affects us through the lifespan, as you all know in this room. So we work for children, young adults, through the entire lifespan, and that's an important thing you can talk about over dinner with someone, not in the elevator, over dinner when you're really getting into the meat and potatoes of what is NF and you're getting ready to tell them all about your story when you were diagnosed. And they say, well, what about the CTF and what are they doing and why should I care? And why should I be involved? Why should I send, my donation or come to this walk? And it's because of all the great progress and all the great things, the great CTF impact, which is, I'm going to let Simon walk you through.
So fortunately, there's a lot to say about what CTF has done and the impact that it's made. So we're presenting this as a very sort of top level, let's call it a menu since we're on the food thing. Although you said meat and potatoes, so I think it's deep dish pizza you're having for dinner. So if you get that chance tonight to have that conversation. So this is a menu. We're going to provide, like I said, we're going to provide this deck. We're going to have links, and I didn't put them on screen because I didn't want to overwhelm with what's on screen. But we'll provide links for each one of these. So when I tell you that the first FDA-approved treatment for NF came through research that CTF helped fund, you're going to have the link that can prove that. Everything on here is true. Everything on here is as a backup. So we'd like you to have that information. It all sits on ctf.org. So if there's ever any questions or you lose the PowerPoint, you can always go there or obviously reach out to us. So we're going to call this a menu. It's about 10 to 15 different items that cover the different bullet points of our mission statement. And again, this is very CTF specific, but I think these are interchangeable, and we have so many partners in this space that many of you have been involved in this work as well. So first FDA treatment, I think we all know about that. We've heard lots about that. Our partners who have made that happen are here, so thank you to them. The other important thing, and this was actually built into that last sort of elevator statement or large coffee cup, was clinical trials. We know that's probably one of the first thing people I hear ask me is, how many clinical trials are there? What are we doing for clinical trials? So we have actually built that into that first elevator pitch, that there are many clinical trials happening. So when you get this deck, you're going to have the link to CTF's website. That our science team updates that, I think, once or twice a year. Or you can always go to clinicaltrials.gov and type in neurofibromatosis or schwannomatosis and find that information. But the work that CTF has done has actually tripled those trials over the last decade or so. Importantly, going back to what Vanessa said, to what Annette talked about this morning, we take a portfolio approach in terms of how we do our work. We're very mindful that there's today and then there's tomorrow. So NF patients and NF families are waiting for something to help them today if they need that assistance in terms of how they live their lives. And then ultimately there's tomorrow. We want to be able to have a cure. We acknowledge that everyone has different meanings as to what cure NF means or what end NF means. This is not the moment to get into that. But our funding portfolio in terms of research, from everything from young investigators to early stage seed funding to more established partnerships that we have with other research organizations, to gene therapy, which is the next bullet on here as well, which is probably more of that tomorrow factor, is what CTF puts its money towards, what CTF puts your money towards to make happen. And again, all this information is available from us, from our development team, who has a really good handle on this too. Annette mentioned this earlier, 10 companies focused on NF, 10 pharma biotech companies, 2 of them exclusively on NF. This was, I want to say 0 not that long ago, or maybe 1. So this is a huge thing. And I'm going to steal something that Annette uses because I like it. I think it works. She says, we've set the table for pharma to come and work on NF. And that's European, so I think Europeans are very friendly and they're always inviting people to the table, but this is actually true. I mean, I've learned a lot about scientific research. I'm not a scientist, I'm a marketing guy. But we learned about incentive system, just listening to Annette, Salvo, and the rest of our science team. So, very often those questions, I think some of them were said earlier, why should we invest in this particular disease? It's a rare disease, we may not have heard of it. Are there enough patients? Is there money to be made? Let's be honest. So CTF, through the next couple bullets, which you're going to see on this list, has set the table. Yes, we have a patient population. In fact, we can deliver that to you through the registry. Yes, we put together a platform with various tools that allow you to access the NF community. Yes, we've done market models. We can show you that this is a disease worth working on beyond just wanting to help patients, which of course all companies would like to do anyway. So, and then we show the things that we've done to prove that. Again, if you're in that dinner conversation, a lot of this might be overwhelming. You might want to choose a couple of those things depending on who your audience is that are relevant, or you may want to just take a print out of this and take them through it again, depending on, this is a conversation we also have very often among our own staff at CTF. If you're at a walk, you might just have a quick little, here's a couple bullets of things that are relevant, but if you're talking to a major donor, it might be a different conversation with a deeper explanation for each. CTF is a leader in collaboration for NF, our Sonodos model, which Dr. Setke mentioned before in her presentation. Case in point, brigatinib, which is an NF2 clinical trial, came out of CTF's Sonodos partnership with other researchers and organizations. So, and there's others. The first pain studies in schwannomatosis, NF1 studies, optic glioma studies, these all came through Sonodos. Now it sounds obvious, right? People should work together, but, and I think at heart people want to, but there are incentive systems for everyone. People, researchers need to publish, companies need to show profit. CTF needs to make sure that we deliver to our promise to our patients, so we can bring people together. And when people, that goes to the next point, when people willingly share their data, which isn't always the easiest thing to make happen, but CTF has this unique proposition of how to make that happen, and that's what we've done. And again, we'll provide those links. Find Annette, find Salvo if you want to learn more about that, or any one of us on the team, Michelle, and we'll get more into that. So that's very important. Again, sounds obvious, but it is unique. This is new to NF. This was within the last 5 to 10 years. This wasn't happening before. So, I mean, in some ways, but not in such a concerted way that has actually led to progress in a very short time. We host the NF conference, which just took place in Philadelphia about a month ago. This is huge, just like this conference is huge. I don't mean just huge in terms of people, huge in terms of impact. Having lead NF experts come from all across the world, and importantly, not just NF experts, but folks who work in the other manifestations that can happen from NF and other fields that are relevant to treatment for NF patients, come to this event, and it just keeps growing and growing. Thank you to Patrice and her team, Angela, and others who've been making that happen. Next year, that scientific meeting and this summit are going to be together in Scottsdale in June. So one part of the hotel will be the scientists, one part of the hotel will be patients and us, the families, and at some point I think we'll come together. The agenda will be shared, but that'll be very super cool to have that all in one place. CTF created the NF registry for all forms of NF. There are other registries that take place maybe in some smaller institutions, but this is for everyone. We have over 10,000 patients. I think we're getting to 11,000. Annette talked about this earlier. It's in multiple languages. If you haven't joined the registry, please talk to our staff. I think Pam is here, or Kate Keltz, and they can certainly help you understand why it's so significant to join the registry. Importantly, that's for the patient side. Importantly, clinical trials and studies have benefited from this. That's setting the table, being able to show companies that we've got this information. We can do a quick survey to the patients in the registry who would like to participate. So it benefits you as a patient because you have access to information that you normally wouldn't have elsewhere, and it certainly helps the people driving the research. The NF Clinic Network sees about 15,000 patients. which is just a fraction of the, let's say, 100,000 or so in the United States, but it's still a very large number. That's also been growing. And importantly, having that connectivity, again, driven by the standards that CTF works with among the different clinics throughout the country, so that we have a standardized care, so that hopefully, we know this isn't always the case, when you see a doctor, depending if you can get to one in your part of the country, that you're receiving the care that is considered best practice for NF. And of course, we always have more work to do with that. Sorry, I'm hitting the mic. And then our clinical care advisory boards, the folks who set the criteria for care. We have one here based in the United States. We have one also based for CTF Europe. And these are also important in terms of, when you do see the doctor, that they rely on information that is accurate and up to date. This is, I think, the last slide. We're the indispensable source for information on NF. We're not the only source. We know everyone can Google. There are a lot of great institutions out there with lots of great information. What we pride ourselves on being is that safe haven. If you come to CTF's website or brochures or to one of us in person and we communicate something about NF to you, you can be assured it's been vetted by our clinical care advisory board, by our medical affairs committee, by other experts if we don't have them necessarily connected to us, so that it's accurate, it's up to date, you can trust it. It's more than just a Google search, because we know there's a lot of scary things on Google. So we pride ourselves on that, and we pride ourselves on sharing it with everyone. If you come from an organization and you'd like to use some of this information, just give us a call, shoot us an email. We're happy to let you put your logo on there as well. We'll have some rules about logo usage. As the marketing guy, I'm going to bring that up. But we're certainly happy to share that information. We think it's silly to duplicate things that exist. If we see other groups who do things in that space, we don't try to duplicate. We talk to them and share their information as well, which you see probably on our social media. We bring NF patients and families together, like here at this summit. We'd like to empower people. Again, other orgs do this as well, so shout out to everyone who works in this space. We're proud and happy that you're able to support CTF to do this in so many different ways: the summit, Shine a Light Walk, Cupid's Undy Run, and the long list that you see there, and more, which I haven't even been able to list because the list goes long. There'll be a connection there to the website to be able to see what those are. And then finally, we feel like we've put NF on the map. We still have a long way to go. A lot of folks have not heard of NF, but compared to 7 to 10 years ago or 5 years ago, through the engagement campaigns, through Shine a Light on NF, through I Know a Fighter, even just having a standardized NF hashtag, which didn't exist maybe even 6 or 7 years ago, makes a difference. So that, because increasingly we're in a digital world and people need to be able to find information. So that was driven by us as well as the partners connected to us. And I'm going to turn it over to Rebecca.
So this is the section that we sort of alluded to. This is your chance to talk about yourself. We're calling this the secret off menu size or order. This is when you tell your story. This could be your road to diagnosis, your manifestations, the challenges, your successes, treatment, all about you and what it's like to live with NF. Other things to talk about: clinical trial or treatment success. Your story can change depending on who you're talking to, how much time you have, and also what you're trying to accomplish. And so since there's a lot that we can say about storytelling, we wanted to also plug and market our next 2 sessions tomorrow. So we have one session on making it personal and communicating your NF story. This is 10 o'clock in this room. This is a panel with a strategic communications expert, a journalist, and a patient whose life was changed when he started to tell his NF story. We want you to feel inspired, empowered, and motivated to develop your own story and seek out opportunities to tell it. And then the other session tomorrow afternoon, 3 o'clock in this room, is about telling your story on social media and elsewhere. You'll get the basic sort of 101 best practices about how to use social media. And then we're going to workshop some content from a couple of our NF influencers, people who we think you're familiar with and with their channels, and have a conversation about producing strategic and creative content about NF and yourself. And then the last item I do want to mention is we have a media center here. So if you want to be on camera, take a couple minutes to tell your story, answer a few questions about living with NF, we would greatly appreciate that. The media center is right across the hall. I don't remember the name of it, but there's a really big sign that says Media Center, and look for the camera crew. Oh, what is it? Gallon 3. And that's it. We hope to see you there.
I don't see any Q&A or questions in the app. Are there any questions? We're a little early, so I'm glad we're efficient. Are there any questions we can answer while we're here? So Leslie. Is that Leslie? I can't tell from the mask. I'm sorry.
Wait, hang on, Leslie, I'm going to bring, get this on, I'm going to bring you a microphone.
Oh, okay, oh, good. And while she's bringing the mic, I just do want to point out, and this is something that that came from a conversation with Matt Hay, who was pointed out at Alexion, and it's the use of the masks. You see a lot of us have the open mask so you can read lips. So it's something that we were very mindful. We were thankful that Matt reemphasized the importance of this, of being able to read lips for many in that community. So, and I just was reminded seeing Leslie wearing the mask. So if you have the opportunity and aren't able to wear that, then obviously it makes sense. So thank you, Matt, for highlighting that for us. Go ahead, Leslie.
Matt, our special sauce, thank you. So you can hear through the mask. Okay. So one of the questions I have, Simon, and for the whole team, I like the new simplified definition. It's a genetic disorder that causes tumors to grow. But what I wondered is, should we consider adding the word can cause? For us, thankfully, Katie is not consumed by tumors and likely won't with the particular manifestation that she's got. So one of the first things people say to me when I say NF causes tumors to grow, they say, oh, how many tumors does your daughter have? And then I find myself, anytime I'm in a position where I'm having to backtrack or explain why something's not what I just said it was, that she doesn't have tumors, then they're already like, oh, well, she's not telling the truth or something. I find myself in that position in my own head and heart, and I wonder if the people that I'm speaking to. So I do add the word can cause in there, but I wondered as an organization if we wanted to add that word or should consider it, or like y'all said, use what works in the situation you're in.
Yeah, so I'm going to call on Vanessa in a second because we've talked about this to no end. So I'm going to say one thing and I'm giving Vanessa a chance to prepare, although she's giving me wide eyes, so maybe not. All right, how about I just talk? I've been talking a lot, so I'm trying to spread the wealth. One, yes, I think it's okay to edit it to what makes sense for you. But what I was going to say about the conversations we've had with Vanessa, there was a video we were doing recently. It's not out yet. It's on genetics. And this topic actually came up from our clinical team, I think from Heather or from Pam, I can't remember who it was that brought it up, probably Heather the most. And it went a little bit to what you just said. It wasn't specifically that. We have had that conversation about can cause versus causes. And we landed on cause, not now, it was a while ago. We landed on causes because it was to what Alissa said. We wanted to create a little bit of that sense of urgency, because if something can happen to you, maybe it doesn't seem as important. But hearing what you're saying, maybe we need to rethink that. But what Heather brought up for us was actually that next line where we start listing all the manifestations, and it's literally one of the first things you say. But the truth is those manifestations only affect a portion of the population. We know that most NF patients aren't maybe so visibly affected, or you may not see those things. So was that the correct thing to lead with? That's what the debate ended up being. I'm not sure we ever fully resolved it. I think I'd love to hear if any others have opinion, since we have a few minutes. So Tracy Galloway, our board chair, says it downplays this. Do you want to give her a mic? Or
Hang on, Tracy.
Tracy, hang on. She's going to bring you the mic. Hang on.
If you get the mic, then no, but you won't be on the captions. They can't caption you if you don't have the mic.
Oh, good point. Okay.
Hi, my name's Tracy Galloway. I don't like to downplay the seriousness of NF. If we're going to get a treatment and a cure, people need to know it's serious and has serious consequences. So that's how I feel about it. If people doesn't think it's not going to affect us or everything's going to be great, why would they care? Why would they give? Why would they be passionate and work hard towards it? The truth is that none of us knows where it's going, but it is serious for many, many people. So I think we should work on that aspect towards that goal, but that's my opinion. A lot of people know me. I'm the current chair of the board of the Children's Tumor Foundation. Thank you.
And also the mom to an NF2 patient, McKillen Galloway, our former ambassador. Any other questions related to what Leslie brought up or comments? We're happy to It's interesting now with the masks. It's hard, I know, but we have one right here. Connie?
Hi, I'm Stacey Raymond. I have a daughter who's 9 years old, and she's not totally affected right now either. And so I echo those feelings. However, I do feel like we don't know what the future will bring. And so I agree that if we don't take it serious now, I don't know what her future is. And I want to guarantee for her future.
Thank you. I think we did have one more right here in the middle, right here.
Hi, I'm not very savvy on social media, but I belong to a number of Facebook groups that are specific to, I have schwannomatosis, that are specific to people dealing with it, surviving surgeries and treatments. But when I look for official, like Facebook groups for CTF, the groups that I have found have like 6 or 7 members. And maybe this is going to be talked about at tomorrow's session, but I just wanted to say, if CTF could have more of a presence on Facebook, I could see so many of these patients, gravitating to a group where they could get some real, like, official, valuable information, because a lot of people on these other groups, they're just kind of floundering, and they ask each other, what doctors do you go to, and how was this surgery, and where can I get evaluated, things like that. So there's so many people that I think could join and participate in the movement, who could be really active and generate funding possibly and things like that. So I just wanted to throw
really
that out.
Very, very good comment. Couple things. One, you're correct. Come tomorrow to the session on social media. I know there's 2 sessions, so if you're able, it'll be recorded so it can be shared. There actually is a discussion as part of that on groups, and it's actually the woman behind you, Sheila leads one of the largest adults with NF groups. So we talk about that example. What we've also discussed, and part of it in the past was just bandwidth and having enough staff. Thankfully, again, with your support, we're able to build out a larger team. We've had this discussion about these groups in terms of who should be really the voice with them. And we're happy to put the CTF, brand or name on it to show that it's official. But at the end of the day, I think patients and families like to hear from each other. You don't want to hear the marketing guy. I mean, maybe once in a while. Hopefully you'll enjoy.
We always love to
hearing
hear from you, Simon.
Thank
always.
you. That's my cheerleader, Diane Owens. Thank you. But at the end of the day, so actually schwannomatosis is a good example because there wasn't till recently a solid schwannomatosis group. I think it was actually Tracy Galloway who actually started one and then turned to us and said, guys, I can't keep doing this. Can someone take this over? And I know we partnered with, and there was another schwannomatosis group that emerged. I'm regretting I don't know the gentleman's name. I've been in there. It's amazing. I don't know if you've seen this group or not, but it's a very good point you're making. This feedback helps us. Part of it also is if you set up a group and no one comes, then what's the point? So if there is a desire for that, then obviously we want to consider that and try to fulfill that. Because you're right, I think without commenting on other organizations or pages, there is some well-meaning mistaken information out there or links to scientific papers that might be fine, but they're not vetted by NF experts that we know necessarily. So we're maybe a little too conservative and a little careful about what we put out, but we could always do better. So thank you for that feedback. Annette, were you about to say something? Or?
Yeah, I think if I look at it, I think it's a simple staffing problem. If you start participating in these Facebook groups and you start commenting, then people consider that you will always be there, and you see the communication team. So we have just a very pragmatic staffing problem here. Either we do it, but then we get dedicated staff who are always, because this is almost a full-time job. People post all the time on Facebook. So We have just decided for the moment to be not officially entering, but it's true, it's a gap. We need to figure out how we can do that.
I think Sheila, if you can pass the mic to Sheila.
Can I,
Okay. Or
I
Diana.
wasn't just here to compliment you. Actually, I have a comment and I have a question. So my thought on the whole cause and can cause, to me, Leslie, that falls into like the coffee cup version, right? So if I'm giving an espresso, I'm running between here and there and someone asks what's on my shirt, you say, well, it causes this. It causes tumors and bone deformities and blah, 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 because it does. But if I'm sitting down with a latte on a sunny day on a park bench and someone sits down next to me and I'm about to get into my personal story, that's when I'll say it can cause this. For my son, we have X, Y, Z. So I don't know if that helps you, but it's helped me a bit. My question was for you guys. I really like that coffee cup sizing thing. I just want a point of clarification. Is the idea that by the time you get to the large cup of coffee, you start off with the short version and then medium and then expand on it? Or
Yes, so if you,
okay.
and I know it's hard with words on slides, but what you'll see, we were going to use colors, but then it gets confusing. The medium and then the large actually have the same language from the small. So it's sort of like, here's your base sentence, here's your next 3 sentences, here's your next 4. And again, I'm going to say this and then hope I don't regret it. You can edit it. Again, it makes sense. You talk about it in the way that makes sense for you, depending on who you're talking to, but don't be inaccurate. So, so when we list the manifestations, we've actually thought a lot about why we listed those manifestations. We're very aware that there's many, many others, but that can also be something, again, if you really feel like you need to do what you need to do. We're not here to force how you talk about things. We're actually here to help. We're just sort of saying, if you don't know what to say, or if you'd like that very quick, sort of pithy statement that says, here's what it is, we know we're at least making progress towards that first goal, that sort of many voices, one message, just so that in general, we're all saying similar things, so that when people hear the word NF, because hopefully they've seen the campaigns and they've seen the Shine a Light, or they've been to a walk, as they're meeting more people and realizing that 1 in 3,000 chances are pretty much everyone probably knows someone with NF, they just don't realize it yet. And it's, with the increased PR that we're doing, hopefully, that message will get out. So I think Sheila wanted to say something.
I'm so glad you asked that question, because this is what we're going to talk about tomorrow on the social media. And I'm over 60, so I'm on Facebook and nothing else. I don't do Instagram.
You're not a TikTok fan?
TikTok,
Come on.
no. I just do Facebook. And you can tell I do, because I spend all day long finding NF Facebook groups. And I stopped at 34. I'm a member of 34 NF-related Facebook groups. I look at them. I can see mistakes. Now, and I have how many are in each group. And I have if they're private. Some groups are better than others, as we all know. And so we're going to talk about that tomorrow, and I'd be glad to share. But here's the one that wins the award for the best named group. Some of you already know this. I know that some of you are already on this group. It's called Kiss My Bumpy Ass. And they have 266 members. But there are some groups here that have 14,000. And that one's called Neurofibromatosis Friends and Family. And that one's pretty good. There are some, like you said, they have to be vetted. We have an Adults with NF Children's Tumor Foundation Facebook group, and I have 3 really good OCD members on that, like me. And we vet requests to join, and we vet the posts. We don't let everything on there. So you can pretty much be sure that it's accurate. But this is the kind of stuff we're going to talk about tomorrow, and if you want to see if your group is on this list, and I'd be happy for you to give me more names to add to it.
Thank you, Sheila. Okay, another question? Sure.
Something about Sheila, but
Was
really
that?
quick
Yes.
first. So we go back about 10 years now, I think, and the first time I met Sheila at one of these events. I'm also an NF mom. I'm Connie Sorman. I'm on the staff at CTF. She had a handwritten list with all of the names of all of the people she knew in her state, and she's been making these lists for 10 years, so kudos, Sheila.
Yep. So be like Sheila is the message.
So hi, I'm Chris Jackson. I'm a mom. My son's 8-year-old. He has NF with tibial dysplasia. Well, he just had surgery for tibial dysplasia. I live up in Anchorage, Alaska, and up until this, I felt very alone. I've had no contact with any NF families. We only ever met one person with NF, happened to be the nurse, checking him in for his surgery. And my biggest hangup is less social media. I have found groups. It's more, my providers have nothing. My providers know very little. And what I would love, what I need is to be able to bring back things to them or to be able to point them to something. You know, your site had information where I can say, here is your provider packet. Here's what I need you to know about us, because it's been very piecemeal and very difficult. And so I want to help them so they can help others. And so that's what I would be looking for from CTF.
Excellent. Look at that, an Alaska connection. All right. Okay, as the marketing guy, you got the photographer got that, right?
There we go. I just want to let you know that coming to this conference and meeting and connecting with people, so that's, it's just wonderful. She just inspired me because I'm in Alaska. I haven't done anything for a while. When my daughter was younger, I did an NF summit in Alaska, and so connected with people. It was the first time that she got to meet people with, they shared cafe LA spots and stuff, so that connection, But I want to say that you inspired me to start a Facebook group. I was like, I haven't done anything for a while, so I started a Alaska NF community Facebook group, because I'm like, we're not connected. Like, we need to be. So I want to say thank you and thank everyone here for the inspiration. So I'm hoping more stuff like that happens and people do get to connect and get to know each other. So yay, I get to meet you.
That's awesome. So we used to have official CTF state pages. Some of you might know that, and let's get this question here. We moved away for that partly from what Annette said, because it took a lot of work to manage them. And also because we wanted them to be volunteer driven. Volunteer, most of you are here, thank you, please stay. Volunteers come and go sometimes, and it was getting a little kooky. So at the end of the day, we actually think this is a better model. Let people set up their own pages. And then to your point, make sure we give you the information you need. We are going to be revamping the website probably by next year, so it might be a little easier to navigate. This is good. The site we have now was good about 5 years ago. A lot of that information exists, but if it doesn't, we also need to hear and see what we can do. And reach out to any one of us, reach out to our clinical team, particularly from what I heard you asking. And then Kate, Heather, Pam also have great information there too. Yeah, and Sheila, exactly. So Sheila is sort of that perfect patient engagement person. So, yep. So a question right here. Another question up front.
Hi, my name is Ken Arcia, and I have NF2. I was diagnosed about 40 years ago, but in all that time, I've been pretty much in my own little bubble, just focusing on myself. And my sister, she also has NF2. Our situation is it's hereditary, so my mom, my grandfather goes way back. Anyway, I just wanted some clarification. I see the term NF used all the time, and that is sort of an umbrella term, right? Mm-hmm. That includes NF1, 2, schwannomatosis. So anytime I talk to people, I always say I have NF2. Mm-hmm. I never just say I have NF. So I want to clarify just that NF is the umbrella term for all three of those, right?
Mm-hmm. So we've historically, or at least in recent history, used NF as the umbrella term for all three. As the scientists and the clinicians have learned more, and there's a talk later today that Caleb Yohei is going to lead, which you should definitely sit in, because that talks about the new diagnostic criteria, the updated criteria for NF2. They have changed the name. You're going to increasingly, everyone's going to increasingly hear clinicians, doctors, researchers start using NF2 related schwannomatosis in place of NF2. Technically, NF as a bucket term is probably incorrect at this point. We should probably all be saying NF and SWN, or neurofibromatosis and schwannomatosis. But again, from a communicator standpoint, that's a lot of words. I think there's a lot of alignment that still needs to happen within the community. So to Vanessa's point earlier, for now, we're sticking with that because it's still the NF Summit. It's not the NF2 schwannomatosis Summit, but we're going to spend a lot of time. So you're not incorrect to keep saying that, basically, is the message. But don't be surprised if in the coming year we start evolving some of that language. But we want to do focus groups with the patient community. We want to get feedback. We know that's, when you've been calling yourself something for 40 years, like you said, it's not the easiest thing to be told you have to say something else. So we're figuring it out, I think is the best answer I can give. But yes, you're not incorrect to keep using that. That's what we're going to do for the time being as well. Yep, thank you. So I think we're almost at time. You can take, there's 3 more minutes, so if there's Darren. Yeah, go ahead. Go ahead, Darren.
It's all about marketing. That's the whole thing. Is marketing basically involves everything you were talking about. Getting the word out is marketing. You can't really say, well, I'm a market guy, so,
Thank you for that.
any time you talk to people, you're marketing, you're lobbying. And so it's all about marketing.
Right. That's true.
Getting the
Marketing
message
does
out
have
is
that negative.
marketing.
Yeah, sorry. But good point. Thank you for that. You're absolutely right. Anyone else? We could probably do 1 or 2 more, or otherwise I know you've been sitting here for 3 hours, so I'm sure folks are. I'm sorry? Okay, so yeah, that's right. So another pitch for the media center. So I know that sounds like a scary word, but there's a step and repeat. You can actually just go in and take pictures if you don't want to get on camera. What we're doing with this footage is we're trying to capture those voices. We may use it for official marketing later. We'll have to see, but we always are in touch with the UFSO. So another pitch for the media center, another pitch for these and all the sessions. Enjoy lunch, enjoy your day. Thank you for coming. Oh, sorry, Kate.
Is it? Oh, there's just a little delay, I think. Okay, sorry. I'm Kate. I'm with the clinics team. Simon is correct. If you have anything that you want to talk to me about this weekend, I'm here. Also, I wanted to remind you that there are 2 lunch and learn sessions that will start at 12:20. One will be in here, one will be in St. Gallen's 1 and 2. You can eat your lunch, and we prefer if you eat it and then join the session. I know 20 minutes is not a lot of time, but it does keep everybody a little safer. So be sure to check those out. Thank you.